Hello, everyone. I'm Kira Phillips. We do start with our top story this hour, and that's the largest healthcare strike in U.S. history, entering its second day now. More than 75,000 Kaiser Permanente healthcare workers across multiple states walking off the job and taking to the picket lines. And now Kaiser says this strike will only hurt the nearly 13 million patients it serves. Our Jaclyn Lee joins us now from L.A., just outside the picket lines there. You've been outside talking to healthcare workers that are striking. What are you hearing? What are they telling you?
Yeah, well, Kira, these healthcare workers are saying the reason that they're striking is because Kaiser is who they argue is putting their patients at risk because of the short staffing crisis. Take a listen.
They finally started moving a little, but they're still undervaluing us. Should we be undervalued? No! We make them who they are. We are the frontline healthcare workers, and we are struggling. We're exhausted. We have been through the pandemic shorthanded. We have still been showing up shorthanded.
And Kira, these workers are saying that because of one person having to do the job of multiple, ultimately it's leading to longer wait times. It's requiring patients to have less care ultimately because they're stretched so thin. And they also talked about they're not getting paid enough for this. Los Angeles and California, it's a very expensive place to live. So some are saying that they're driving very far just to get to work, and their wages are not keeping pace with inflation. So ultimately, they want to see changes from Kaiser.
So negotiations not going anywhere at this point. Both sides remain in deadlock. What are healthcare workers still looking for in this contract?
Yeah, but ultimately, the biggest thing they say is they really want Kaiser to change how short-staffed they are. They say Kaiser has so much money and that it would not be that difficult to be hiring more people. So as I just mentioned, one person's doing the job of many. They've also talked about they want better pay, they want better benefits when it comes to retirement, and they also want protections against outsourced and subcontracted work as well, Kira.
And Kaiser Permanente did release a statement saying that a number of tentative agreements were actually reached during bargaining. So what were the initial agreements back then?
Yeah, so Kaiser, they did meet some of the demands of the union. They said they did come to a conclusion with wage increases, improving health and retirement plans, as well as renewing both tuition assistance and training programs. But the reason this strike is happening is because they were not able to come to enough agreements. So that's why these healthcare workers are ultimately walking out. They say they want to take a stand, Kira.
So what about the patients that are in a Kaiser facility right now? Are they getting the care they need?
So Kaiser said they did hire outsourced workers. They said they're keeping the hospitals and all the emergency rooms open. So those contract workers are the ones coming in who are taking the place of those who are on strike.
All right, we'll follow it. Jaclyn Lee there in L.A. Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.